This morning? If not, if I could, please let me introduce my legislative intern for the day, my extreme right over here, Kendra Wiseman. She's with the Kentucky Nurses Association. If you would, please welcome her to our committee meeting. Senator Nemes, you have a guest.
Yes, thank you, Mr. Chairman. I have our fantastic Judge-Exec Jerry Summers here. Since he's taken office, the county has just expanded and gotten out of debt, done a fantastic job. Thank you.
Glad to have you this morning. He always speaks glowingly about you that way, so just don't think it's a committee meeting. But anyone else? If not, we'll jump right into the agenda. We're going to change the order of this a little bit because we have some bills I think we can get through very quickly. I'm going to save Senate Bill 37 for the last because I think it'll spend the most time consuming and constraints we're working under. So with that, excuse me, I always get a hold of myself. We need to have roll call.
Senator Rocky Adams. Here. Senator Berg. Senator Carroll. Senator Funky Fromeyer.
Present.
Senator Nemes. Present. Senator Tishner. Senator Wise.
Present.
Vice Chair Douglas.
Here.
Chairman Meredith.
Present. We do have a quorum. And now we have Senator Carroll here, so add him to the list. Senate Bill 90, is Senator Higdon here? If not, let me move on to Senate Bill 110. And this is Senator Lindsay Tishner. If you would, please go to the table. Now, so you do have a guest. If you would, please identify yourself for the record.
Kelly Jenkins, the Executive Director at the Kentucky Board of Nursing.
Lindsay Tishner, Senator from District 6.
Well, I know Senator Tishner is going to hate me for this, for drawing attention to her, but I think this is her first bill that she has presented as a senator. And I know she will knock a home run today. So if you have any questions, make sure they're softball questions, okay?
Yes, thank you. Appreciate that.
With that, Senator, please feel free to proceed.
Yeah, so we actually have a committee sub that we need to vote to adopt.
Second.
Motion second on the sub. All in favor say aye. Aye. Any opposition? Seeing none, please proceed.
Okay. So this is just SB 110 is a cleanup bill from SB 10 from last session in regards to the Board of Nursing. Just a few corrections with KR 13 to make those congruent. And the committee sub is actually a change to the number of nurse educators that would be on the board. And it previously stated 6, having trouble filling 6. They decided to change that to no less than 3 members and no greater than 6. And she can explain that if you need any questions, have any questions. That was easy, yes.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Funky Fromeyer. Aye. Senator Nemes.
Aye.
Senator Tishner.
Aye.
Senator Wise.
Aye.
Chairman Meredith.
Aye. And the vote is 8-0. The measure passes with favorable expression. Congratulations, Senator, on your very first bill. We'll do 111 next. Next bill on the agenda we're going to hear is Senate Bill 111. And this, the primary sponsor is Senator Amanda Mays Bledsoe, another rookie. Even though she's not a member of our committee, please let's have the same ground rules and treat her kindly. Is this your first bill, Senator? Congratulations. If you would identify yourself for the record and as well as your guest, and we will proceed.
Thank you so much, Chairman. My name is Amanda Mays Bledsoe, and I'm the senator from District 12.
Go ahead. Hi, I'm Jennifer Mooney, the District Director of Health at the Northern Kentucky Health Department.
I'm Scott Lockard, Public Health Director, Kentucky River District Health Department and Chair of the Legislative Committee for the Kentucky Health Department Association.
Glad to have you here. And Senator, I see you have a committee sub.
I do, please.
I assume you would like approval of that sub.
I would.
Entertain a motion. Motion by Senator Carroll, seconded by Senator Wise. All those in favor of the motion vote aye. Any opposed? Seeing none, please proceed.
Thank you, Chairman and members of the committee. The substitute bill to Senate Bill 111 allows Kentucky's large independent health departments flexibility in hiring a health commissioner by changing the current requirement that the health commissioner be a physician. This legislation allows other highly qualified public health professionals who have earned a minimum of a master's degree in public health or a related field and who have at least 5 years of managerial experience in a health department to serve in that role. Like the chief executive officer of a hospital, the health commissioner is the chief administrator responsible for the functions of the health department, and the licensed medical professionals are engaged to provide clinical services. Currently, Northern Kentucky District Health Department has this flexibility, but Lexington and Fayette Health Department and Louisville Metro Health Department of Health and Wellness do not. These large health departments have experienced difficulties in hiring physicians in recent years, and this request needs to change. Next, I'm going to turn it over to let Ms. Mooney talk about the public health things, and also we have several members of the local health departments here with us today who also like to, we're grateful for their support.
Thank you, Senator, and thank you to the Health Services Committee for considering this important bill. Again, I'm Jennifer Mooney at Northern Kentucky Health Department. The Northern Kentucky Independent District of Health has operated under the ability to employ a non-physician for about 20 years. This has allowed for the district to attract and hire leaders with public health experience from a wider pool of candidates to benefit the agency. This has been a very successful model for our health department and community. Local health departments provide a large and varying range of services and programs today that are significantly different than they were decades ago. Public health departments deal much less with medical patient care and more with the social determinants of health, for instance, factors that may affect how health care is accessed. Today's public health also focuses a great deal on environmental conditions, exposure risks to the communities at large, which obviously affect individuals. While a medical doctor with public health training can provide leadership at the local level, so too can professionals with related degrees and years of experience in public health. NKY Health uses a model of contracting with a medical physician to serve as the medical director. This person provides reviews and approvals for medical protocols and practices as needed, provides limited medical services, for example, our TB, tuberculosis patient care, and also serves as a consultant on various services or program topics. This is shown to be a tried and true model for many years for us, a high-performing local health department celebrating its 10th year of public health accreditation. Thank you for your consideration.
And I will just add to their testimony here that of the 61 health departments across the Commonwealth, all the other health departments too outside of Lexington and Louisville employ a model similar to this. We used to have health officers, MDs, at health departments across the state, but as the focus of health departments has changed, we have now gone to public health directors with varying other degrees, and we all contract with an MD for that medical oversight to work under those auspices. So we appreciate your consideration and are glad to answer any questions you might have.
Any questions from committee members? Motion on the bill by Senator Rocky Adams, seconded by Senator Douglas. Roll call.
Senator Rocky Adams. Senator Byrd. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Funke Fromeyer.
Aye.
Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Aye. Measure passes 8-0 unanimously, and we'll proceed with favorable expression.
Thank you so much.
Congratulations.
Thank you.
I'll go ahead and do mine. Did you sit in the chair? Next item on the agenda is going to be Senate Bill 43, which is my bill. I ask our Vice Chair to assume the chair.
Thank you. Would you please introduce yourself to the committee and the people in the room, and we'll proceed.
Since you asked so politely, I most certainly will. I'm State Senator Steve Meredith, Senator for the 5th District, and very pleased, Mr. Chair, to present Senate Bill 43 to you this morning. And this is a simple little bill.
Before we get started,
I got
Senator,
a
I'm
committee sub.
sorry. We do have a committee sub.
Yes, I do.
So, second? Motion by Senator Adamson. You got him? Okay. We have a motion on, we have a sub for Senate Bill 43. All those in favor say aye. All those opposed, nay. Okay.
Thank you, Mr. Chair. Always in my endeavor to keep this train on schedule, I get a little bit ahead of myself, so I appreciate you slowing me down just a little bit. I appreciate that. So said, Senate Bill 43 is a simple little bill. We hear that a lot in Frankfurt, but this one truly is. And it deals with essential caregivers. And many of you will remember that we passed Senate Bill 100 back in the 2022 session to establish rights to designate an essential caregiver to residents in person at long-term care facilities, hospitals, and our state mental hospitals, and required our Cabinet for Health and Family Services to promulgate regulations to accommodate that. What I've asked in this bill is to kind of broaden the scope of that, because obviously our healthcare delivery system covers much more than that, such as rehab facilities, outpatient services. So that's in essence what this bill does, to expand both of that, not just to address the COVID pandemic, but anytime we have this type of health crisis, that we could still have essential caregivers to assist in the care and treatment of their family members, which is the case in most instances. But additionally, again, extend that privilege to other healthcare facilities that are not within this current bill. So that's my bill, Mr. Chair. I entertain any questions, comments.
I'd like to make a motion.
I have a motion and a second. Clerk, please call the roll.
Senator Rocky Adams, Senator Berg, Senator Carroll,
Aye.
Senator Douglas,
Aye.
Senator Funky Fromeyer,
Aye.
Senator Nemes,
Aye.
Senator Tishner, Senator Wise, Chairman Meredith.
Aye.
Thank you, Senator Meredith. We have 8-0. I know that that surprises me a little bit, but I really appreciate you being here this morning. I appreciate your presentation. Senate Bill 43, as amended by proposed Senate Substitute 1, has passed with favorable expression.
Thank you.
We thank you for your presentation this morning.
Thanks, sir.
Senator Higdon. I pass the gavel back over to the chairman.
Good morning, Senator Higdon.
Good morning, Mr. Chairman.
So pleased you could join us this morning.
Well, thank you for allowing me to be here this morning. It's,
Would you, if you would, please identify yourself for the record.
Thank you, State Senator Jimmy Higdon. And
you have a committee sub.
I do have a committee sub, Mr. Chairman.
Motion on the sub. Motion and a second. All those in favor vote aye.
Aye.
Any opposition? Obviously none. Please proceed.
Thank you, Mr. Chairman. This is a public safety issue of making sure residents of drug rehab centers have transportation home if they decide to voluntarily leave. And the bill, it's still in your words, simply says, any treatment center or program licensed as a chemical dependency treatment service shall provide transportation services to the resident who wish to voluntarily leave the treatment program if, after expressing the intent to voluntarily leave, the treatment center informs a family member, guardian, or emergency contact of the resident's desire to leave. If the resident's family member, guardian, or emergency contact does not agree to pick the resident up within 24 hours, then the transportation shall be provided by the facility, providing they shall provide access to a ride-sharing service or purchasing a one-way service to the hometown of record, or providing access to public transportation, including but not limited to transporting the resident to the nearest commercial bus line and purchasing a ticket to the hometown of record. Also, Mr. Chairman, the bill says the facility and law enforcement officers shall not drop those voluntarily leaving the facility at any location other than a public transportation location, or to meet at a location where a driver of a ride sharing service will pick them up or at the resident's home. And also, Mr. Chairman, prior to a resident being admitted to a facility, the facility shall conduct a search for any outstanding warrants. That's it, Mr.
Thanks,
Chairman, and like I said, it just provides a way home for these folks if they decide to leave.
Obviously, this is in reaction to, I would assume, a problem in local communities.
Yes.
Can you elaborate on that just a little bit?
Well, there's, we had several reports of walkaways at some of the treatment centers in my district, and they just kind of end up in town or at people's homes, and with somebody else having to deal with the issue of those folks not having any place to go after leaving the center. They can leave any time. They're not there. They're not court ordered to be there. They're there voluntarily, so they can leave any time. So if they decide to leave, we need to try to get them back home instead of the residents of the community dealing with them.
All right, thank you. Senator Carroll has a question.
I know of a situation where a young lady was court ordered for treatment. A couple days later, boyfriend picked her up. She drove off. Under these circumstances, I'm assuming there would be a requirement for the facility to notify the courts, or how would that be covered?
Senator Carroll, that'd be a good amendment to put on this, that they would be required to do so.
Okay. Thank you.
I don't know if there's a requirement now for that, but that would be a good amendment.
Okay. Thank you. Thank you, Mr. Chairman.
Senator Douglas.
Thank you, Mr. Chairman. Senator Higgins, this is a wonderful bill. Previously, before redistricting, I had some of these facilities in my district, and that was a concern that many people shared. That is, it's actually a voluntary. There are voluntary facilities, is what we're looking at. They're not necessarily all court ordered, and people were leaving their facilities at all hours of the night, and they were wandering the streets. And many of the people in the community shared with me their concerns for the safety, not just the safety of the community, but the safety of those individuals. So I really want to thank you very much for bringing this bill, sir.
Thank you, Senator Douglas.
Motion on the bill. Is there a second? Second by Senator Douglas. Roll call.
Senator Rocky Adams, Senator Berg, Senator Carroll,
Aye.
Senator Douglas,
Aye.
Senator Funky Fromeyer, Senator Nemes,
Aye.
Senator Tishner, Senator Wise,
Aye.
Chairman Meredith.
Aye. Vote is 8-0. This bill passes with favorable expression. Congratulations, Senator. Appreciate you being here this morning.
Thank you, Mr. Chairman and members of the committee. Mr. Chairman, obviously you've been taking some lessons from your roommate and conducting the meeting. Thank you for being very efficient and on time. Thank you.
Well, I hope you know the train leaves on time and it arrives on time. So thank you, sir.
Thank you.
Last but obviously not least, we have Senate Bill 37. Senator Julie Rocky Adams.
Mr. Chairman, may I make a couple introductions?
I wish you would, please. Yes.
I have in the audience Dr. Don Hine, who is the president of the Kentucky Dental Association. Dr. Hine, where are you, sir? There you are. Welcome. And I also see Dr. Sean and Evelyn Jones in the back. Welcome to you all. And Dr. Sean Jones, welcome home, sir. Thank you, Mr. Chairman.
Thank you, sir. Appreciate you all being in attendance today. Senator, you have a committee sub. I guess you need to introduce yourself for the record first.
All right. My name is Julie Rocky Adams, State Senator from District 36. And I'd like for my guests to introduce themselves.
Yeah. My name is Trent Blacketer, licensed pharmacist in Kentucky with Synchrony Pharmacy with our home office in Louisville, Kentucky.
if you could try that again. I don't believe your mic was on. And we'll make sure we get
I
that
apologize.
recorded,
Trent Blackader, licensed pharmacist in the state of Kentucky. Worked for Synchrony Pharmacy based out of Louisville, Kentucky.
I'm Jerry Summers, Bullock County Judge Executive of Senator Mike Nemes's district, one of the fastest growing communities in the Commonwealth of Kentucky.
Appreciate you being here.
Mr. Chairman, I would appreciate a motion on the sub.
Motion on sub. Motion by Senator Nemes, second by Senator Carroll. All those in favor vote aye.
Aye.
Opposed? None. Please proceed.
Okay, thank you, Mr. Chairman. Senate Bill 37. So, we talk about modernization in Kentucky, but as the chairman knows as well as I do, anytime anything new is proposed, it does become a heavy lift. People are generally averse to change, and pharmacy is one area that has evolved into a really dynamic economy in Kentucky. And it's very important that all perspectives and ideas are considered when creating new public policy. So I guess let me give a little primer on where we are, how we got to this point with the sub on Senate Bill 37. So 37 was originally filed in response to a regulation by the Board of Pharmacy to change licensure for out-of-state pharmacists. This would have had a dramatic impact on the practice of pharmacy across the state of Kentucky. And so during the regulatory process, there was a lot of angst and communication. The Board of Pharmacy ended up pulling that reg back. So 37 was, the genesis of 37 was just to keep things the way they have been for the last 15 years. So it was just a codification of the current regulation. Now, also attached to 37 was, through the sub, was my original Senate Bill 95, which was the board reorganization for the Board of Pharmacy. And so where we got on the board reorganization is that we agreed to establish, that is already in regulation, an advisory council. So we took that board makeup, which would have increased the expertise for the Board of Pharmacy, and we transferred that expertise into an advisory council. So, and because of technology pressures yesterday, we weren't able to finalize where we were on this compromise bill. So, I need to impress upon the committee that negotiations are still ongoing. And I've had very positive communications with people even this morning in my office. We had the Pharmacists Association and the healthcare, the independents in my office to talk about options as we go forward. But as you know, it's a 30-day session, so time is of the essence. And so in order to keep this moving, I hope that we can pass this bill out of committee today, knowing that the commitment is there, I believe, from all sides to continue this conversation so that when we do bring it to the floor, it's something that we can be proud of, and it moves the ball forward on increasing a level of expertise that I think is badly needed, and also increasing that conversation on how, when we make regulations, how it affects different practices of pharmacy across the state of Kentucky. And so I don't know if my guests would like to share a little bit of perspective.
Sure. Mr. Chairman and members of the committee, thank you for allowing me to speak today, and I'm going to make this brief. I'm here to support our closed-door pharmacies located in Kentucky. I'm here to ask you to make sure that our regulatory bodies support rather than deter these large employers in Kentucky. Our geographic location in the country and the UPS Worldport make Kentucky prime real estate, prime job growth with high-paying positions. To attract these specialized pharmacy employers that are very much a part of today's economy, specialty drugs and supplies that are not available through our retail pharmacy can be and should be a key economic driver in the Commonwealth of Kentucky. The Kentucky Board of Pharmacy has a critical role in ensuring patient health, but I've learned that the board has repeatedly restricted pharmacy practices that are commonly allowed in other states. In taking such a heavy-handed approach, the board inhibits economic development in this industry. These two very important factors of safety and development can and should be complementary. I wanted to be here today to support Senator Rocky Adams in her efforts to modernize a board that has not seen modernization since 1942. And I think we all can agree that a lot has changed in the world since 1942. And again, thank you for for this opportunity to speak here today. Support Senator Adams.
So again, I'm with Synchrony Pharmacy. We're a licensed long-term care pharmacy in the state of Kentucky as well as other states. We provide services to residents in skilled nursing, assisted living, personal care, independent living, nursing home communities. As a company, we have 8 pharmacy locations which serve residents of these facilities in 20 states. That's involved obtaining a number of out-of-state pharmacy permits for those locations to serve those patients in not only the states we operate in, but also the states that we have out-of-state permits in. So currently our company has 2 resident pharmacies in Kentucky. We also have 2 out-of-state pharmacies that have out-of-state permits in the state of Kentucky. We maintain those primarily in the event that we have business continuity needs in the state of Kentucky so that we can continue to provide care for those long-term care residents. The 2 out-of-state locations, one's in Nashville, Tennessee, the other in Indianapolis, Indiana. We believe that the addition of the board proposed regulation, which Senator Adams has mentioned, has been pulled, but just want to state the potential harm that this could cause. That states any person who engages in the practice of the profession of pharmacy for a Kentucky resident shall hold an active Kentucky pharmacist license, creates an unnecessary burden. Currently, the out-of-state pharmacies are required to have a pharmacist in charge that is licensed in the state of Kentucky, as well as they take responsibility for the care that's provided to residents in the state of Kentucky. Likewise, each board of pharmacy in a non-resident state requires the pharmacist to hold an active pharmacist license, requires all pharmacists to hold an active pharmacist license in their resident state, which other board of pharmacies regulate. So requiring each pharmacist who engages in the practice of pharmacy for a Kentucky resident could certainly result in delays of therapy for Kentucky residents. The regulation's counterproductive to the goal of promoting, preserving, and protecting the health, safety, and welfare of residents in Kentucky. No other state or commonwealth in the nation has this strict of a requirement for the provision of pharmacy services by an out-of-state licensed pharmacy. So we highly recommend that the Commonwealth of Kentucky follow the same process that works in other states, as well as non-resident out-of-state pharmacies, and not require every pharmacist to obtain a non-resident pharmacist license. Again, it creates an administrative hurdle for out-of-state pharmacies in their attempt to provide safe and reliable care to residents in the state of Kentucky. I also want to make comment just on another issue that's been brought up within this, and that is around the additional use of the NABP Verify program. We, as a company, we don't have issue with the NABP Verify program that's been proposed. The issue is there's been proposed a $250 additional application fee beyond the $50 cost of that NABP Verify program by the board. That's higher than what a pharmacist must pay to maintain their licensure in their resident state in 40 states across the nation, just to be able to get verified in the state of Kentucky. So, again, we need to make sure we're not placing additional burden on those pharmacists. The Kentucky Board of Pharmacy estimated themselves that the revenue generated would be upwards of $750,000. That's going to come directly out of the pockets of pharmacists that are providing care to residents in the state. So primarily, those are the comments I wanted to make, just to make sure that we understand the administrative hurdles and burdens that this Board of Pharmacy could be creating. Thank you.
We do have a couple of people signed up to testify, but I would entertain any questions for these folks. Seeing none, I'd ask you folks to kind of hang loose after we hear the testimony. Maybe invite you back to the table for some clarification. But appreciate it.
Thank you.
First on my list are representatives from Kentucky Board of Pharmacy. If you would, please proceed. Really? For Julie?
Good morning, Senators. I'm Eden Davis. I'm Eden Davis. I'm General Counsel for the Board of Pharmacy, and we're joined by our Executive Director remotely. He was presenting at a conference in Florida, so he's joining us via Zoom, and I'll let him begin.
Good morning. Can everyone see and hear me okay?
We can. If you would, please identify yourself for the record.
Perfect. My name is Chris Harlem, the Executive Director of the Kentucky Board of Pharmacy. And joining me is also Bill Cover with the National Association of Boards of Pharmacy. So I just want to first thank the committee, thank Chairman Meredith for the opportunity to speak today on behalf of the Kentucky Board of Pharmacy today regarding Senate Bill 37. Let me start by just saying that the Kentucky Board of Pharmacy has required licensure by non-resident pharmacists dispensing prescriptions to Kentucky residents for years. During the pandemic, we saw this exponential growth in the remote and shared services sector. This shifted the practice of pharmacy away from traditional models. Despite this change and growth and innovation, it is critical that the board maintain its jurisdiction over pharmacists dispensing prescriptions to Kentucky patients. Kentucky patients must be protected. And let me also just add for a moment that dispensing of a prescription really is a complex process that involves really much more than placing pills in a bottle. Dispensing includes performing functions such as a drug utilization review, interpreting clinical data, performing therapeutic interventions, patient counseling. Additionally, pharmacists perform activities such as compounding, such as non-sterile or sterile, sometimes high-risk sterile compounding, which includes making medications that are injected to the bloodstream. And these are all areas in which errors can certainly be had. And next, I really just want to talk a little bit about the foundation of our jurisdiction. As you know, the mission of the Kentucky Board of Pharmacy is public and patient safety through effective regulation of pharmacy practice. KRS 315, which is our Pharmacy Practice Act, states that the purpose of the chapter is to promote, preserve, and protect public health, safety, and welfare by and through effective control and regulation of the practice of pharmacy. And it specifically states that the licensure of pharmacists, whether located in or outside of the Commonwealth. And further, 315.020 clearly states that no person shall engage in the practice of pharmacy unless licensed to practice under the provisions of KRS 315. I next want to shift a little bit and talk about some of the concerns that we've heard, and certainly concerns that maybe you have heard as well. And let me address the concern that we are changing the status quo, resulting in a drastic shift in regulatory scope. The board is really simply attempting to address these new technology, new models, new complex distribution schemes through effective regulation. In fact, this is our responsibility in protecting the citizens of the Commonwealth through appropriate oversight while allowing these new advances in processes and technology. I also want to emphasize that many of these current models are not necessarily new. In fact, many of these models already fall under our current law, and pharmacists already require licensure by us. We have been operating this way since 2006, when the use of common database was implemented in Kentucky. Our current regulations address areas such as common database and central fill in which the patient is receiving specific services in Kentucky, but the workload is outsourced to other facilities, frequently out-of-state pharmacies being provided by out-of-state pharmacists. Our laws have been clear that any pharmacist practicing within these models must hold a Kentucky pharmacist license. We currently license over 5,500 non-resident pharmacists today, in which 4,500 of those are not serving as a pharmacist in charge. 47% of the pharmacists licensed are non-resident. Let me repeat that because that's an important point. 47% of the pharmacists we license today are non-resident pharmacists. This Senate Bill 37 is what would change the status quo. To address why this may seem to be a new requirement, we now know and realize that there is a misunderstanding. Our current laws are clear, and we are adapting our rules to the advances in practice today. In other words, these so-called new rules were brought about by new arrangements not currently addressed in our regulations. The board has demonstrated support for these new advances in technology. The board must maintain the jurisdiction to ensure the safety of the Kentucky citizen. This is why we are so concerned with Senate Bill 37. Without jurisdiction, we cannot effectively protect the people of the Commonwealth from pharmacists in violation of pharmacy law or bad actors. Industry is asking for our guidance, and we are responding to ensure the continued safety of the citizens of the Commonwealth. Next, let me address the assumption that under Senate Bill 37, that the public will be fully protected because the board licenses the pharmacy and the pharmacist in charge. This is not true. Liability does not automatically transfer from the actions of the pharmacist to the pharmacy or the pharmacist in charge. Our laws are very specific in the creation of specific responsibilities of the pharmacy, the pharmacist in charge, and the individual pharmacist. Let me provide an example. Let's say a pharmacist is employed or contracted with a non-resident pharmacy providing services such as a drug utilization review or a therapeutic intervention, such as determining an appropriate dose of medication for a child. Let's say this is a rogue pharmacist acting outside of the parameters of Kentucky law. For example, this pharmacist does not appear to be mentally fit for practice. The notion that we should issue an emergency order of suspension on a pharmacy permit or a pharmacist in charge for this individual pharmacist is extreme, and it puts the people of Kentucky at risk. If we issue an emergency order of suspension on either the pharmacy or the PIC, the pharmacist in charge, the shipment of medications to Kentucky would have to cease, creating a significant access issue for our citizens. The Board of Pharmacy needs to be able to provide pinpointed discipline without unnecessary collateral impact. And let's remember that pharmacists would still be left practicing. Another argument is that we should rely on the state in which the pharmacist is practicing to act. Well, I ask the legislature this: do we want to rely on another state to protect the people of Kentucky? The Kentucky Board of Pharmacy would have no control on the actions or the timing of potential actions by another state board of pharmacy. Let me be clear. The citizens of Kentucky should have assurances from the Kentucky Board of Pharmacy. That is our charge and mission. Senate Bill 37 provides no such assurances. And I want to be clear. I want to emphasize that we are treating the non-resident pharmacies and pharmacists with the same standards as our in-state pharmacists and pharmacies because both are servicing the citizens of the Commonwealth. The people of Kentucky expect our protection, and we must have equitable rules for any pharmacy or pharmacist for our citizens. I would also like to address the next concern with Senate Bill 37, and that is related to controlled substances. Under KRS 218A, which is Kentucky's Controlled Substance Act, pharmacists must be licensed by Kentucky in order to have the authority to dispense controlled substances into the state. Remember that pharmacists dispense, not pharmacies. Without a license from us, pharmacists would be prohibited from dispensing controlled substances into Kentucky. While Senate Bill 37 may remove the Board of Pharmacy's regulatory authority to license non-resident pharmacists, KRS 218A mandates licensure if dispensing controlled substances to residents of the Commonwealth. In effect, if Senate Bill 37 passes as written, the effect will be that out-of-state pharmacists that don't voluntarily become licensed in Kentucky cannot dispense controlled substances into the state. Further, 218A.202 requires that pharmacists obtain a CASPR account. Without a license, the Kentucky Board of Pharmacy will have no mechanism to enforce compliance. I want to end by talking a little about the meeting with stakeholders. So the Board of Pharmacy's General Counsel and I met with a group of pharmacy stakeholders and the lobbying firm, the Rotunda Group. We met in August to discuss concerns of non-resident licensure. The stakeholders explained that enforcement of non-resident licensure would place a burden on both pharmacists and pharmacies. When pressed for details on the administrative